Welcome to the Alzheimer's Association COVID-19 and Caregiving presentation. In today's agenda, we'll talk about three areas. So COVID-19 and dementia, tips for caregivers, and resources that we have through the Alzheimer's Association. Most likely, dementia does not increase risk for COVID-19, the respiratory illness caused by the new coronavirus, just like dementia does not increase risk for the flu. However, dementia-related behaviors, increased age, and common health conditions that often accompany dementia may increase the risk. So, for example, people living with dementia may forget to wash their hands or take the other recommended precautions to prevent the illness. So again, understanding that, we are told that we have to stay 6 feet apart from people, wearing masks, and that may be a challenge, having that on their face, understanding that 6 feet. So those are some of the things that may increase that risk in terms of following precautions. COVID-19 may worsen cognitive impairment due to the dementia. In COVID-19 and tips and topic sheets, we do have some wonderful information on our website. So again, we know that this is such a challenging topic, how to care for someone during this time, whether it's at home or in long-term care in a community. So the Alzheimer's Association on our website, the www.alz.org/COVID-19, does have topic sheets for caregivers. And that could again be through caregivers caring for someone at home, whether it be individuals in assisted living. And so really, what are some of those things that you can do to help as you're caring for your loved one? Next, we're going to talk about the tips for caregivers at home. So we definitely, again, encourage following the CDC guidelines and to consider the following. So individuals living with dementia may need support to remember the most important. So you might have to consider maybe placing signs in the home above the sink that says you need to wash your hands with soap for 20 seconds. We've heard definitely sometimes even pictures, right? Actually showing what that looks like, demonstrating so that they can follow what it looks like to do that thorough hand washing. With hand sanitizers, the minimum 60% alcohol can be an alternative if someone cannot get to the sink or wash their hands easily. So again, very kind of sound simple reminders, but may be helpful at home. And again, to do those reminders, to have those reminders for someone that may not easily remember that they have to do these things. And some more tips for caring at home. So for people living with dementia, increased confusion is often the first symptom of any illness. So if a person with dementia shows rapidly increasing confusion, contact your healthcare provider for advice. So again, this is something that, the illness again is usually a progression, but if it's something that's happening just, one day to the next, a lot of times we talk about what could be a urinary tract infection. They can cause, delusions, hallucinations. Sometimes it could be medications, a change in the medication, so that we're just not assuming that those changes are attributed solely to the dementia. There could definitely be many other things going on. And again, especially if they have underlying other conditions, hypertension, diabetes, so those things could be affecting their behavior, their health. So taking a look at that thing, those again, not just assuming it is the dementia if there's a rapid increase in confusion. And then requesting prescriptions for greater number of days. So sometimes, again, the idea that we're, trying to stay as isolated as possible, right? To stay as healthy and not be in those large crowds, not going out as often. So instead of having to go pick up those things as often, it might be best to ask for those prescriptions, the 90-day prescriptions, mail order. Even I know mail order can be very helpful in delivery for medications. And then think ahead and make alternative plans for the person with dementia. Should adult daycare, respite care be modified or canceled in response to COVID-19? And I know, unfortunately, in our area in San Antonio, there have been some adult daycares that have had to close their doors for right now due to safety. So those caregivers that really relied on going there in that respite, didn't have that anymore. So really, talking that through, planning, contacting the Alzheimer's Association for resources on what can be done. Definitely too for in-home care. I know a lot of home health agencies are just being, of course, extra cautious and being very careful when they send in a professional caregiver, right, an aide or someone that has been going in to take care of a loved one, that they're just making sure that they're following those guidelines to still be able to provide that care. And then think ahead and make alternative plans for care management, right? So if the primary caregiver should become sick, I think in any case, even prior to COVID, right, talking to caregivers about making those plans. What if something should happen to you and you don't have that backup? Is there someone else that can come in and help take care of you? Again, especially COVID right now, we have those times where someone has to self-isolate, has to quarantine. So just think about, as a primary caregiver, if something like that should happen, do you have plans? Maybe it's contacting a local long-term care. Sometimes I know they have places where, they can stay for a short amount of time if you're not able to take care of your loved one during your own illness. So again, even thinking about prior to COVID, and really sitting down and making those plans of, do you have a backup? Is it another family member? Is it a friend? Or do you have to seek professionally, communities that may be able to help take care of your loved ones? So definitely things to think about. And so again, some more tips for caregivers of individuals in this time in care facilities, right? So we know that, and we've definitely been in contact with many communities, and I have to say that I have such admiration for, having professionals in this day and time in terms of being, having to take care of those loved ones when their caregivers are outside those facilities, and the challenges with not being able to see their loved ones, and you as professionals having to deal with all of that. Gosh, it's been so challenging right now. So when, as family caregivers, if you're thinking of your individual and your loved one in that facility, so making sure that you're checking with the facility regarding their procedures, right, for managing COVID-19. So what do they have in place, right? What kind of things do they have in place? So, and we also have tips for caregivers of individuals in assisted living. The CDC has provided guidance to facilities on infection control and prevention of COVID-19 in nursing homes. The guidance is for the health and safety of residents, and precautions may vary based on local situations, right? So we know that we're in certain areas, especially in Texas, that we've had a lot more cases. So something that looks here in Texas, maybe more restrictions, could be very different, right, in another state or another town. So really having to make sure, you're aware of that as well. And then ensuring that, facilities have emergency contact information, right? The information of a family member, friend as a backup. So if they have to contact you as a family caregiver, they're able to reach out to you if there's been some changes. Also, I think too, we talk a lot about, right, staying connected. I know that thankfully it sounds like, there's been some lowering of some cases, although we still have to be very cautious, but there have been some lessening, some restrictions. So I have heard from some family caregivers that have, had limited access to be able to see their loved one that lives in a facility. So, but really thinking about, if making sure that all of that information is there. Also that, there's ways that they can get a hold of you. I've heard of, some facilities where they're using, FaceTime, they're using technology, right? Tablets, iPads. So to really do some of those virtual interactions with their residents' loved ones when they can't actually physically visit them right now. And then of course, do not visit your family member if you have any signs and symptoms of the illness. So making sure that, and I know it can be difficult and you definitely want to see your loved one, but not doing that when you're having some signs and symptoms that could be potentially COVID related. And then if visitation is not allowed, right? So ask the facility how you can contact your family member. So again, the video calls, the emails, telephone calls. So really thinking about how, can be creative. And I've definitely seen, the creative side of definitely facilities trying their best to really think about, being creative in how the families can visit the loved ones in the facility. So whether it's coming to a window, doing the drive-through kind of hellos, leaving messages. So in terms of how much contact can be had in this time. And if your family is unable to engage in calls or video chats, ask the facility how you can keep in touch with the facility staff themselves, right, to be able to get those updates. So who's that person there in the community, in the long-term care community, that is able to be contacted, how my mom is doing, how's dad doing, be able to give you those updates. I've definitely heard too, caregiver very, again, creative and trying to think about if they're not able to kind of do the live, maybe recording some things, right? So caregivers, family caregivers that have recorded themselves speaking to their loved ones, videos. So again, that person may not be able to do the live and beyond, but that facility staff can play something for them, that they recognize voices, faces. So that can be another way in thinking about connecting in whatever way possible. And so looking at kind of residential facility incidents considerations. So in the facility, some kind of things to think about, right? Asking the facility about their quarantine procedures, right? So what do they do if they're having to quarantine who may be positive or may have had a test, for COVID? What is your level of confidence that CDC guidelines are being followed? Again, really that communication with the long-term care community about what's being done. How many people in the facility have been impacted by COVID-19, right? Staff, residents, or both. Is your family member able to follow social distancing procedures, right? With or without help? Again, that can be that challenge with those with dementia, and why the staff, right, can really work with and put those things in place in the facility that will help with that. Does the facility have personal protective equipment for PPE? So what are they utilizing when they're working with your loved one, when they're moving about the facility? How many staff members interact with your family member on a regular basis? Right? Is the facility able to limit this number? Is the facility adequately staffed to provide the level of care required? So again, just some things to think about. I know many, again, facilities have been very proactive, many communities, about making sure that their families know what's going on, what they're doing, but it doesn't hurt to ask those questions to really think about that when your loved one is being cared for and you're not able to readily kind of see them, see what's going on. So, being able to ask those questions and being confident to know that facility is doing that for your loved one to keep everyone safe and their staff. So a little bit more things to kind of consider. And this has, I know, been a really kind of, again, another big challenging ones. Again, we always say there's no simple answers. Please, by me saying these things does not mean it's not, we know it's a challenge. There's no right or wrong answers. It's a lot of times individualized, right? And what to talk it through, to think about it. So these are the things that we want to bring up because we just want you to be able to kind of think about it, work it through and see what's the best decision for you and your family member, your loved one. So we have had some situations where, of course, I think when COVID kind of first was starting and we had more of the outbreaks and, caregivers really contacting us to say, should they move their loved one out of a facility if they found out, there was COVID. And we absolutely, any change in routine, right, it can be very much difficult for someone with dementia, right? So routine. So making those kind of big drastic changes can make things even more difficult. So really having to consider if you're thinking about, if those were thinking about moving their loved ones. So then there was no way, right, to know whether the new facility will remain COVID-free. So, right, you kind of uproot your loved one, you move them, and it should, if it happens in another facility. So there's no way to guarantee for sure that it would be happening in a facility. And is the facility accepting new residents? Again, during this time for the safety and health of all of that facility's residents, staff, they may not accept a new resident. So thinking about that. Have there been COVID-19 cases in the new facility? Again, if you think that it's, not going to be there, but you move your loved one and something happens, there's not that guarantee. Asking many of the same questions you would ask from previous, right, from those slides before is, what precautions are they taking? What safety measures? Really just thinking about what that means for your loved one if you are, thinking about moving, right? What are those challenges too? Also thinking about, what made you put them in that facility, right? The care, the level of care that they're getting. Also for some that maybe even thought about bringing their loved one home. Are you capable of doing that? Is your own home equipped to do that, right? Also, again, that other slide that we talked about too, what should happen to you as a caregiver if something should happen to you with your loved one and not being able to care for them. So again, all of these things to consider, if really the fear of COVID in a facility, but also the challenge then of what are you uprooting and moving them to another location, right? To think about all of that. And then so kind of some things to consider, right? Moving a person home. Again, if some, and we have had some instances where, there's been some questions and trying to think about this from caregivers. So moving a person home. So as we continue to say, it's important to note that there's no simple answers. And at this time, there's no way to completely eliminate the risk of your family member being exposed to COVID-19. However, there are some questions to consider if you're faced with this situation. Right? So these answers to these questions can help you make the best decision for you and your family. Again, right, it is very individualized. Moving a person home. So what kind of level of care does the person need on a day-to-day basis? So for example, the person is able, are they able to bathe or dress him or herself? Are they continent? Are they ambulatory, or do they need assistance moving? So is your family able to provide that level of care needed? So again, all those things that the facility is doing cannot be duplicated at home. Does anyone in your family have COVID-19 currently? So the same issues of not being able to guarantee someone in a facility, can you guarantee that in your home? Are those individuals in the home who work outside, right? So definitely, first responders, all of those kind of personnel that, needs to be working. So if someone is inside your home that is also working and has to be out and about, so thinking about that. And so of course, again, this option comes with its own level of risk. So really thinking about that as well. And then so, for those that are caring for their loved one at home, really thinking about how do we, right, routine, I said routine, right? That can be very beneficial for someone with dementia, but we've kind of been all thrown out of this routine, right, into a little bit of confusion and uncertainty. So how do we kind of maintain those things that can be helpful and a little bit of routine at home? So again, we have some great resources on our website, the alz.org/care, that has some things that you can do in terms of activities with a loved one at home, keeping them busy. So creating simple daily plans, kind of heard a lot, right, to be very intentional with the things that we're doing at home. So to create, a simple plan, possible, the daily things. So keeping your loved one kind of occupied, right, in terms of what's going to come next, what activities are going to be done. So, and keeping skills and abilities still in mind, right? What are they capable of doing? And family caregivers, right, a lot of times have to adjust their usual routines. That's what's been happening. So it's important to continue to engage the person living with dementia, whether it's including them in regular tasks or planning activities that you both enjoy, creating a plan, spending time thinking about a schedule that you can make these adjustments. And I love this one, focus on enjoyment, not achievement. Being full exposure to upsetting content. So this definitely, we've heard a lot of caregivers are saying, we turn off the TV for a little while. It's good to be knowledgeable. We want to be educated on things, but sometimes, right, it can be overwhelming. And especially someone with dementia where, sometimes the ability to separate reality can be very challenging. So hearing about all of these things, they may be taking that very much to heart, right? Is it happening here? Is it going to happen to me? So that can make someone with dementia more anxious, right? So we've had caregivers that have mentioned that their loved one, has more anxiety, more stressed. So really kind of being mindful of what they're watching, what they're being exposed to in this kind of world of, again, the news and what we're seeing. So really thinking about that. But definitely hearing a lot of creativity in caregivers about what activities that may be limited inside the home, or even now, being able to, at least take a walk, go in the yard. But we also, again, have some tips and some things, activities that can be done and what your approach can be to that.